What's all this fuss about red and near-infrared light? What are they? What are the benefits? And what are the specs you should be looking for when seeking such therapy? If you've been following me, you'll know that I am a long-time fan of both red and near-infrared light. I've been using it for a year now and credit it for its contribution to my endo pain relief and post-op recovery. Red light therapy, otherwise known as photobiomodulation, is most commonly identified as a beauty treatment. We've all seen a few hundred red light face masks on social media, promoted as a skin enhancing treatment that reduces the signs of aging by stimulating collagen synthesis. My mask from Dr. Dennis Gross has definitely made an appearance on my socials. I do credit it for skin improvements such as plumper looking skin, and that's exactly how red light works. On a superficial level, penetrates the first 1 to 2 millimeters of skin layers and helps improve skin health. That includes scar healing too, whether it's acne scarring or post-op scars, which is all great stuff. But for endometriosis, you need to know about near-infrared light. Think of infrared light as a gentle, invisible sunbeam, where its rays penetrate deeper into your body, traveling beyond the skin's surface, reaching your cells, tissues, muscles, and even your joints. Places where we know endometriosis tissue likes to live and take the piss. So what does it do for our insides? How does near-infrared light provide pain relief? Near-infrared light reduces inflammation and oxidative stress by acting like a chill pill for your immune system. It does this by dialing down pro-inflammatory signals, in other words, cytokines, which tend to be ramped up in women with endo. And it boosts antioxidants, which mop up the free radicals that are causing oxidative stress. Shifts your cells from panic mode to repair mode, helping to calm things down. Another thing near-infrared light does, it increases nitric oxide. Nitric oxide is a naturally occurring chemical in the body that relaxes blood vessels, enabling more blood to pass through. In other words, it increases circulation, which means more oxygen is being delivered to your cells and areas of the body where there might be stagnation, like your pelvis. With endo, adhesions and lesions can restrict blood flow, leading to painful cramps. This production of nitric oxide, increased blood flow, and delivery of oxygen to the pelvis helps bring relief. Think of it as unplugging a backed up drain to reduce pressure and soreness. Then you have ATP production. Every cell in the body has tiny power plants called mitochondria. Mitochondria make ATP, the body's energy currency that powers everything from muscle movement to healing. Infrared light pokes the mitochondria and supercharges their ATP output, like jump-starting a battery. For endometriosis, this does two things. It helps combat fatigue, a huge symptom from constant inflammation draining your energy reserves, by giving your cells a quick recharge, and fuels cellular repair, helping fix damaged tissue and promote healthy healing. Speaking of mitochondria, it gets better because it turns out that our ovaries are full of mitochondria. In fact, the egg cell has the most mitochondria of all cells in the body. Ipso facto, infrared light may support ovarian health and therefore fertility. By energizing ovarian mitochondria in the same way described earlier, infrared light may improve ovarian function and egg quality. Infrared light has been shown to reduce DNA mutations and improve mitochondria function. In fact, a Japanese study found that low-level laser light therapy improved pregnancy in 2/3 of women who had failed IVF cycles. The therapy appeared to have a positive impact on blood flow, the fallopian tubes, and uterine tissue. But we still need more research in this area. Talk about a multitude of benefits for women's health. Now do you see why I love red light therapy? But not all light is built equal. When it comes to deciding on LED light therapy, you have to take into account wavelength. Things are about to get technical. Don't tune out because this is the important part. Nanometer is the measure of wavelength of light emitted by a device. With red light, you're looking for 600 to 650 nanometer wavelength range. With near-infrared light, you want a device that provides anything from 700 to 1100 nanometers. With light therapy, you need targeted delivery straight to the skin, to the problem area, And consistency is key. It's not a one-time thing, not even a once a week thing. I'm talking 20-minute sessions 3 to 5 times a week. So, do you use red light therapy? Do you have any questions about infrared light? I'm excited to share that I'm currently investigating at-home devices, and I'll be updating you with my findings. So stay tuned.